The number one risk factor for stroke is high blood pressure. And the greatest bang for your buck in terms of reducing your risk is blood pressure control. And one of the things that people have misconceptions of are what is a high blood pressure. Now, this is a little bit detailed here. So if you've ever had your blood pressure checked, there's a top number and a bottom number. Systolic is the top, diastolic is the bottom number. And this is your risk of dying from stroke with those blood pressures. Now, a lot of people come into my office and say, well, you know, my blood pressure's 130-something over 80-something. You know, that's not really hypertension, is it? And you can see that even as you go into the 130s, the risk of having a stroke goes up dramatically. So more than twofold higher than a lower blood pressure, say 112 over 71. So we say, and I'll mention this again in just a minute, your goal blood pressure is less than 130 over 85. And this slide shows why that is very clearly. So, as I mentioned before, what we're fighting here is a disease of multiple blood vessels in your heart, going to your brain and your legs that cause atherosclerosis. Hypertension is our crown jewel, our number one target. We want that number less than 130 over 85. Cholesterol, high cholesterol is something that a lot of people focus on, and it's very important. I think a lot of it comes from television ads where you see people skiing down the side of a mountain with a number written on their back, and you think, I've got to be below that number. Most people probably having the bad cholesterol, the LDL, less than 130 is okay. If you have risk factors, or you've had a stroke or a heart attack, you want that number less than 100. Not as important as treating hypertension, but still very important. Smoking, I think, you know, in the U.S. we've done a fairly good job of reducing our stroke risk rates, but still there's a persistent problem. And there are a lot of people who just, you know, they'll say, I'll treat my blood pressure, but I can't give up my cigarettes. This is a picture of an artery that was surgically removed in a normal procedure from someone who was a smoker and a non-smoker compared to it. And you can see all the plaque buildup in the blood vessel and actually microbleeding inside the vessel that was taken out. And I'm sure there'll be some questions about what medication is best for preventing and should everybody take an aspirin. What I would say is that if for any reason, family history or one of the risk factors that you saw listed before, if you have those, taking a baby aspirin a day is a reasonable thing to do, unless you have an allergy or stomach problems that you have aspirin sensitivity, is a reasonable thing to do for prevention. One question I always get with regards to stroke prevention is diet. You know, that's one thing people feel like they can control. They don't need the doctor. You know, what's the best diet to prevent a stroke and a heart attack? And, you know, I think it's still an area of controversy and one in which I don't have great expertise personally. There are diets called heart-healthy diets. You may have heard of the Mediterranean diet. And we do know that there are dietary habits that are associated with populations that have decreased risk of stroke and heart disease. The general principles are to stay away from high-fat foods, to have carbohydrate-rich meals and lots of fruits and vegetables, and that certain oils, like olive oil, are better than other oils, say like peanut oil. With regards to what you could do, there's a lot of information that's out there on the internet, but I think if you have a good primary care provider, that's where you have your conversation about how you can help reduce your risk of stroke and heart disease. A good diet and physical activity can minimize your need for medication. I think most people don't like the idea of taking pills, or if they have pills, they want to take fewer. Very often you can control hypertension and cholesterol through diet and exercise. Very often that's not enough just because of the genes that you got from your parents.